as we're a youngster, we usually start out with little fillings, and as we get into our 20s or so, or even early 30s, we end up a lot of times having recurrent decay. We get busy in our 20s and we're just left home and that's not a priority. So you end up with a larger filling. And they're usually in your first molars, because your first fillings usually become in your 6-year molars, because they're the first molars you get. And they're the first ones we get to crown, because they'll end up with a large filling. And if you have occlusal disease where they crack or break, or if you have basically recurrent decay, we end up doing what we call a crown or full coverage, because basically it just goes around the complete tooth to keep it from splitting. And so in our practice, because of our digital dentistry, we're able to take a picture of that tooth and then basically build it up so you have a nice strong core or foundation for that crown. And then actually that day when you leave here, you can have a full coverage crown put on that tooth and keep it very strong. A lot of times people don't realize fillings in the center of their teeth are just like wedges. Just like when you put a wedge in a tree and you keep hitting it over the years, it will actually split the tooth. So we have people, when we take out that original filling they have, there's a long crack running front to back. And a lot of times those teeth, if you don't crown them and you try to refill them, they're going to split, or you're going to end up having a diseased tooth and either need a root canal or an implant.